My name is Lauren Karpinski. I am a dermatologist at Apex Dermatology in Medina, Ohio. I specialize in medical dermatology, and I wanted to talk about the number of reasons that it would be very important for you to see your dermatologist instead of your primary care provider for certain conditions that might come up. So the first common skin condition that we'll talk about is a lot of patients develop rashes on their legs. They may think that it's related to their laundry detergent or something that they've applied to that area, that they've developed some kind of allergy. But in a lot of cases, it's actually related to swelling in the legs. It can show up as discolored red or purple patches. It can scale, it can itch, it can even ooze. It can be very painful for patients. They can develop ulcers on their legs. A lot of times if they are seen by a provider that's not as familiar with the type of skin condition that it is, which in many cases it can be something called stasis dermatitis, which directly results from the swelling in the legs. It can be mistreated with a lot of different topical medications that can actually make things worse. A lot of these patients need a specialized form of compression stocking. They have a lot of different measurements and styles and types that dermatologists are very familiar with prescribing. And then there are also certain medications that can be applied to that area to really help heal things as quickly as possible. So the second thing we'll talk about is warts. A lot of patients do go to their primary care providers for warts, and in some cases things do resolve with one treatment. Dermatologists, however, do have more specialized methods for treating warts. We're often a little more aggressive with the liquid nitrogen freezing, which, while there are over-the-counter products available that claim to be able to freeze warts off, in a lot of cases, these just become expensive for patients without showing great results. When liquid nitrogen freezing does not work, dermatologists additionally have injectable medications and lasers that can help to get rid of warts for lesions that are particularly stubborn. So the third thing we'll talk about, poison ivy, everyone's favorite in the summer. Poison ivy can go on for weeks and weeks. It can be anywhere from mild to very severe, depending on how much of the body it affects. And the amount of the body it affects isn't always related to how much of the skin was actually exposed to poison ivy. It can spread beyond the areas that touched the affected plant. Dermatologists are very familiar with how to treat poison ivy. It often requires an extended course of oral steroids beyond the 5 to 7 days that would be prescribed by an urgent care or a primary care provider. If it's not treated appropriately, often after a couple weeks it can return with a vengeance. So I would encourage anybody who thinks they've developed poison ivy to call their dermatologist first. So the fourth thing that we'll talk about is acne. Acne is a very frustrating thing for a lot of patients. It can go on for years before it's appropriately treated. Patients can spend a lot of money at drugstores trying to treat it on their own. There are a lot of different acne medications available. All of them do different things. There's also many different types of acne that should all be treated differently. Your dermatologist is most familiar with the different types of acne and the different types of treatments that would be most helpful for certain individuals without giving you that red, flaky, irritated skin that a lot of over-the-counter products can. We can also help you clear up your acne as quickly as possible with the least amount of scarring. I would really encourage any patient with acne to come see one of us first. It can actually save a lot of time and frustration and quite a bit of money as well. So the final thing we'll talk about is full body skin exams. Everyone at some point in their life should start getting one of these from head to toe. It is very important to become familiar with the moles and the brown spots that you have so that if new things come up, you're able to point them out. And sometimes patients just can't see many areas of their body. It's not that easy to see your back and your neck, and while significant others can help you keep an eye on those areas, a lot of times they have questions too, and they might be concerned about something that they saw on your skin. So I would really encourage everybody to come see a dermatologist at least once a year to have all of your spots looked at. especially things that aren't healing, things that are changing, things that are maybe bleeding or sore. We at Apex Dermatology will always get you in within 1 to 2 days to check out your concerns.